I became a healthcare professional for Divine Mercy and founded the organization as a result of taking care of my trauma patients and also from 9/11. I realized that we needed so desperately to pray for those that were dying when we had the tragedy in the United States. So I thought maybe the nurses that I work with, they could come with me and we could go to New York City and be a part of helping. But what happened is the Red Cross told us, no, we think everybody has already died. And I said to the staff that worked for me, I think we should pray the Divine Mercy Chaplet together. And to my shock, my own nurses that worked for me for years, they didn't know what that was. So I became inspired that we have to teach healthcare professionals how to be spiritual nurses or spiritual doctors. Even though we can't be at the bedside, we can still pray for those that are sick, injured, or dying long term, far away. And even St. Faustina talks about this in the diary, how efficacious the Divine Mercy Chaplet is. And we can pray it for the dying, whether it's near or far away. So I started on this journey, and of course I have worked with the Marian Fathers of the Immaculate Conception from the National Shrine of Divine Mercy in Stockbridge. And Father Serafin Mikolenko at the time, I knew very well, and I started writing little chapters on how a nurse or a doctor can render spiritual care to the patient. And as it turns out, we are required to render spiritual care by either sharing faith with the patient, calling pastoral care, and being sure that the primary goal in pastoral care is the administration of the sacrament of the anointing of the sick. So the focus of our training program is to empower the healthcare professional, number one, to know, first of all, the sacraments have the primary goal of spiritual care. Secondly, how to use the Divine Mercy message and devotion to care for the sick, injured, and dying. So over the years, we developed a manual, and Father Serafin produced it in Stockbridge. So from this point on, we have an annual conference. We have hundreds of healthcare professionals, nurses, doctors, therapists come from all over the US. We have international speakers that come, and we present on medicine, bioethics, and spirituality, and the practical application in the healthcare setting.